Okay, good morning. This is Edward Ng with the Pittsburgh Foundation. Welcome to the monthly COVID call. Just want to make sure everyone is aware that we are, of course, recording this and will be available for rebroadcast at a later date. With that, hold your questions to the question box and we will answer them after the webinar. I think that was the housekeeping, so hand it over to Phil Koch.
Great, thanks, Edward. Appreciate it. And thank you all for joining us once again, and for all of our panelists that will be with us today. Before we get started, I do want to send a thanks to the Westmoreland Museum of American Art, who always sends us the artwork that is on our title slide here before we get started. Always nice to take in some good artwork and appreciate that work before we dive into the heavy stuff. This painting actually is a painting called March by George Benjamin Lukes. He had always worked in watercolors and often used the medium for outdoor scenes, such as the Westmoreland's High Bridge Park. A bright, pure color of white paper with much of the white showing through adds to the sparkling beauty of this piece. And that, again, is from the Westmoreland Museum of American Art. Always a pleasure to have their contribution. Today we've got a strong agenda. I'll start with some announcements from the Community Foundation of Westmoreland County and the Pittsburgh Foundation. We've got Alyssa Chodovsky, who always is here as my co-host, if you will, from the United Way, as well as Sarah Stanger from Behavioral Health and Developmental Services with the county. We'll then hear from Dr. Fox from Excella. Commissioner Sorelli is actually with us here today, which we're really happy about, to give us a welcome from the county. Bud Mertz is here from Public Safety, as well as Dr. Matt Thomas from the IU. Jennifer Miller will talk to us from the food bank and give us updates, as well as Deb Thakara. Dan Carney will talk a bit about housing, and then we'll round that off with Jordan Polito, who's here from the Hill Group, to talk about the human services study that we've been working really hard to complete. So we're glad we have all of our speakers and panelists here with us today. Just two quick announcements from the Community Foundation of Westmoreland County. First, we are in the midst of our granting initiative called Revitalizing Westmoreland, which is really about developing community assets in many of our towns and municipalities. So this work is really funds that will help us create new playgrounds, help us do storefront improvements. Maybe it's lands, maybe it's beautifying green spaces, anything where we're developing the assets that are within our community would qualify as a project. So you can check out our website, the Community Foundation of Westmoreland County's website, for all of the details. That application is due on March 26th, so we're about 2 weeks away. Would encourage folks to jump on that if you haven't already. If you have any questions, though, feel free to reach out. I can certainly help you navigate that application or explore ideas with you. So feel free to do that. The other announcement that I wanted to make is that, as many of you know, I've moved on as the Executive Director of the Community Foundation of Westmoreland County into a new role at the Pittsburgh Foundation as Vice President of Policy and Community Impact. And we've been in the midst of a search to find my replacement, to find the person who would come in and be the next Executive Director. Happy to announce that we have hired McCray Martino as the next Executive Director of the Community Foundation of Westmoreland County. McCray comes with over 20 years of experience in nonprofit and foundation work. Most recently, she's served as the Vice President of Human Services at Goodwill of Southwestern Pennsylvania. Also spent some time at Partners for Work, working as their COO and Chief Program Officer, which is really focusing on workforce development. And then prior to that, she also worked at the Forbes Funds, where she focused on nonprofit capacity building and running their management assistance grants program. So really great to have McCray with us. Her and her family live in Westmoreland County, and she's really excited to dive into the work and to start to partner with all of you. So she starts on April 12th. So you actually will have me for one more of these meetings, since our next meeting, I think, is about 4 days before she starts. But really want to give a warm welcome to McCray, and I know you all will incorporate her into our work as we move forward. So with that, I want to move and pass the mic over to Alyssa Chodovsky, who's the Regional Director of the United Way, our close partner. Any updates from the United Way?
Yes, good morning, everyone, and thanks, Phil. Great news on McCray. So just wanted to talk a little bit. First, I'll give some quick 211 data. I just took a look, just as curiosity, instead of doing the month, looking at the last 7 days of 211 calls. For Westmoreland County, we've had just over 300 of those calls. 79 have been for rent assistance, but the biggest number is in healthcare. People are calling, over half the people were calling about the vaccine, about still testing, about questions, and access. So it's on the top of everyone's mind around the county and in other places as well. The other higher calls are coming in for the tax prep program. For those who know, we support Westmoreland Community Actions efforts to assist people in getting their taxes done. There's a lot of money out there for people who maybe traditionally don't believe there's money for them. If they can get access to someone that'll do their taxes for free, they often will see a fairly large return on that. So still taking appointments, and for that, if anyone knows people in that that need that support. What we have been really working on lately is our vaccine community partnership. United Way is assisting Excella Health with opening some access to individuals, those over 65, who are currently in programs with our community partners, Open Your Heart to a Senior, which is now with Wesley Family Services, as well as Laurel Faith in Action, and then the Westmoreland County Area Agency on Aging. And I think kudos especially go to Bud Mertz. Thank you so much. He's kind of the person who started this conversation going with United Way, with AAA, and then we had parallel conversations with our United Way and Dr. Fox and John Spahn from Excella. And through all of these conversations and partnerships, we have started doing some scheduling. We had the ability on Friday to schedule 100 appointments for this week. These are individuals who don't have technology, who are struggling to get the vaccine, and so grateful for the support of the partners that we've put together with this, and especially for Excella Health, who has given us access to their scheduling software to support this effort. We did another 100 yesterday and today for people who will go tomorrow morning to Excella Latrobe. So hoping as this starts small, we can build upon this effort as we learn how it goes, and then eventually be able to also serve people with disabilities, people in other vulnerable communities. And we were also working with Voice of Westmoreland, which has been a strong partner for us here, helping to support this community effort. So really exciting news, I think, for tackling an issue that kind of a lot of people were struggling with. And even though it's small scale, just excited to have this effort. I want to say thanks to all the people who have joined me in this effort to put it together, especially also Westmoreland Transit is helping, Veterans Cab through Community Action. I mean, just it's been an amazing partnership. So excited about that. With that, I think that's my big news, and I will turn it back to you, Phil. Thanks.
Awesome. Thank you so much, Alyssa. I appreciate it. We're going to now turn to Sarah Stanger, who's with the Westmoreland County Behavioral Health and Developmental Services. One quick note is that she will be talking about a handout that you'll see on the next slide that is available for you to download if you click the handouts link on the right hand of your screen. Sarah, over to you.
Hi, good morning, everyone. Yes, as Phil had said, we had put together 2 pages of trainings. We're working on some more, actually. We're trying to develop trainings threefold, actually. One for the community, one for providers and staff, and one for consumers. So there's numerous trainings, as you can see, being offered. Once we get a little bit more details too, I'll be sending this out on our website and on our Facebook link. But I've tried to throw something together quickly today so some people could start to save the date and share the message if you wanted to. We have numerous options available, some for the LGBTQ community, impact bias, military sexual trauma, let me see, there's human trafficking, and there's different areas too that we're targeting for May as Mental Health Month through Mental Health America. We've been trying to work with Mental Health America and WICSE, our base service unit, to try to see what we can do for the community and try to really open up services and how to deal with anxiety, and to offer CEUs for a lot of individuals. These are all free. More links will be added. We just tried to throw something together quickly so everybody could see what is going to be available, but we will be posting more information. I'm trying to think. There's different options here too. We have mental health first aid training for adults and for children. A lot of these are going to be virtual. I'm trying to think. No, not on this list so far are face-to-face. There is a couple more that we're working on. Some of the details trying to sort out that they have not been able to be approved yet for to virtual training, but we're trying to work to see if we can get that done before the end of the year. Another area and if anybody has any questions or if you would like to see anything else that we can look into, please just reach out to me and we'll try to see what we can do. We are trying to meet the needs here, and it's just hard trying to get everybody's schedules to work in sync here. Another area I did want to touch is we are seeing a very high need for staffing across all of our levels of care. This goes down to licensed social workers, for nurses, personal care home staff that work within our mental health community, for housing programs. So if you know anybody that is looking for employment, and these are all over the county too. I mean, we're looking for Monessen, we're looking for Trafford area up north, and a lot in Greensburg here too. But if anybody is looking, or if you have somebody coming out of school or will be coming out of school shortly, please have them reach out to me or one of my staff, and we can try to link you to a lot of the providers that are hiring. But it's worse than it's ever been with hiring right now. So if you know anybody, please just reach out and we'll try to link you. I think that's all I had today, Phil.
Awesome. Thanks, Sarah. Appreciate that. Let's move on over to Dr. Fox with Excella Health. Dr. Fox.
Good morning, everyone. It's good to be with you all again. As we look at COVID-19, the numbers are definitely declining. That being said, we still do have 23 individuals who are hospitalized within our health system. Our Fry Farm Road site continues to be open. Just to give you an idea, we have performed over 21,000 drive-through testing events there, as well as about 3,500 face-to-face visits. So that's kind of in the context of, our overall testing. We've tested over 35,000 unique individuals since the start of the pandemic. We had been giving monoclonal antibody infusions. Those are designed to prevent hospitalization and to prevent deaths in high-risk individuals who are not yet hospitalized. We have actually moved those infusions from the Fry Farm Road site to our Frick campus. So those are still available. And we have, sent a lot of education to physicians in our area, making them aware that it's something that they can use for their patients. For the month of March, the positivity rate of the testing that we have done is about 10%. So that's much lower than it's been in prior months. So we're very pleased about that. Probably the biggest thing that is top of mind of everyone, ourselves included, are our vaccines. To date, we've either completed or scheduled about 24,000 vaccinations. We had been using our 3 hospitals. We then moved to Excella Square at Latrobe. And I'm happy to tell you that on March 18th, we're going to move that operation to our Norwin facility. And in that facility, the former movie theater, the former Galaxy Fitness Center, will be our vaccine distribution site. And we anticipate that, based upon the amount of vaccine that we received, we'll be able to vaccinate 2,000 individuals daily there. As a starting point, we plan to open 3 days a week, but we can open more. And should we be fortunate enough to get a lot more vaccine, we would, be able to use Excella Square at Latrobe, as necessary. This past week, and in anticipation of the rest of this week and next week, we were the fortunate recipients of 5,000 vaccines. So we're very pleased with that. We're very pleased with our collaboration with a lot of different individuals. So a lot of shout outs are necessary. You know, Alyssa already mentioned the work with the United Way and 211, and of course our great work with Bud Mertz and emergency management, as well as with our commissioners, Commissioner Sorelli, Commissioner Curtis, and Commissioner Chu. They've been really helpful to us and have been advocating very strongly to the state to ensure that Westmoreland County receives the vaccines that, you know, we should have based on our county membership. In terms of vaccine scheduling, we're doing so through our website, www.excelahealth.org. And we also have a telephone line, 724-689-1690 for individuals who don't have internet access. And of course, as Alyssa mentioned, the work that's going on with 211. So we're very pleased at the recent turn of events in terms of the number of vaccines that we've been allocated. So, you know, we'll continue to move on. And I'm also pleased that our educators will be able to have access to vaccines through the intermediate unit. So that's another means for members of our county to receive vaccines. So I think all in all, things are going well, but we're happy to be here with you and to work with you.
Thank you, Dr. Fox. Really great to hear that the vaccine distribution is ramping up, and sounds like you all are really doing a great job of staying on top of that. Thank you. Commissioner Sorelli, I believe, is with us today. Commissioner, if you want to unmute yourself and give any updates or welcome.
Thank you so much. Good morning, everyone. It's great to hear from everyone. I just want to say thank you to Dr. Fox and to Alyssa. You guys said it perfectly. This is such a partnership with everybody involved to help get our senior citizens vaccinated. I can tell you that my aide Celeste will say she has a list of hundreds of senior citizens that have called, that have been trying to get vaccinated, crying every single day to her because they can't spend the 4 hours on the computer, or they're not savvy with the computer. So they have family members that are trying to work, raise a family, but still spend 4 hours a day trying to find their family members' vaccination appointments. So to Excella, thank you so much. I believe it's 10% that you're allotting to United Way and Open Up Your Heart to Senior. So thank you so much. And like you said, to the Transit Authority that is giving individuals free rides to their vaccine appointments, and everybody. I know there's a lot that I can't list. I wish that I had more information to give you today. We're still waiting for more vaccines to come in. My contact at the governor's office for the past few weeks said once Johnson & Johnson gets approved, that's when we will see a bigger vaccine allotment and be able to do mass vaccination sites more easily. So now that is in play, keeping our fingers crossed that in the next month or so, we are able to start seeing those large amounts of vaccines coming into Westmoreland County. As Dr. Fox said, all of our teachers will be receiving Johnson & Johnson, the intermediate unit, and that should be, I believe, this weekend and finishing up by the end of the month. So hopefully once we're able to get all of our educators in the state of Pennsylvania vaccinated, we will then be able to move on to the next group as well. We are still waiting, keep fingers crossed, everything comes through with Westmoreland County with the stimulus bill. We don't know exactly how much. There's a lot of different numbers being thrown around, but my biggest priority is once that money comes in, I want to get that money onto the streets and do the grant rounds like we did before for nonprofits and small businesses. So please stay tuned to that. There's a lot of things we have to work out yet. And first we have to see how much money we're getting, but I believe it's going to be a large sum, much more than what we received the first time. So I'm excited to be able to help get that onto the street as soon as possible. That's about it. Thank you guys so much for everything that you're doing. And 2021 is already looking to be a better year. So let's just hope that it goes better. This is probably I think this weekend is our 1-year anniversary when we had the press conference that we were declaring Westmoreland County as a state of emergency declaration. So it's been a whirlwind year. So thank you to everybody for everything that you have done for our community throughout this year.
Thank you so much, Commissioner. I'm really glad that you were able to join us this morning, and you're always welcome to be with us. So thanks so much for your time.
Thank you.
I'm gonna go ahead and move on over to Bud Mertz with Public Safety. Bud, I know you've got a lot on your plate. What updates do you have for us?
Well, good morning, and thank you, as always, for being part of this. I got to reflect a little bit here because it's been a crazy year as we approach the anniversary. You know, March 18th at 11:30 p.m., I got my first phone call from the state saying that we had our first 2 cases in Westmoreland County. But you know, being in public safety my entire life, you're always looking at bad things. You're always told that what you have to do is everything bad, you have to look at the good of it. And so I really got to, again, reflect back on this past year and how it's been a tremendous year of partnerships going into it. As you look at it, I mean, we've had wonderful dialogue with this group, with the Westmoreland Foundation, with the Westmoreland Human Services Committee as well. Excella Health, I think that myself and Dr. Fox are on a constant communications wave, either by phone or text or email or whatever. You look at what our first responders have done, stepping up to the plate, especially our EMS providers, you know, our paramedics and our EMTs, and the dialogue that we've had with that. You know, I mentioned the community, the county's human services side, and where we've been with that. The intermediate unit, I never talked so much in the past year with the intermediate unit, and everything's going. Our dispatchers in the room and everything that they've gone through, screening every calls to protect the first responders and what they've done. You know, and the transit authority. There's just a few that I can name that it's just been a tremendous partnership that really brings out what Westmoreland County is about and the community that we work with. So it's a tremendous, you know, we talk about the 3 C's. We talk about cooperation, communications, and collaborations, and that's what this whole year has been. Also, to acknowledge our county commissioners who really been super leaders in this. I you know, remind them of their executive role, although that you don't have to remind them, but their executive role as incident commanders in this and what they've done, being out front of the issues, communicating with the public, as well as supporting public safety. This past year, you know, we were able to get Cass Kovac as our public information officer, who immediately, you know, took charge of realizing what information, the value of information sharing, and pushing the information out to all of our partners that we had there. We also were able to, fortunate enough to pick, add a new position to our staff as being a Michelle Zona coming in as our access and functional needs planner and coordinator, to focus on those that need the most help during any disaster, and everything that she's done. We've pushed out 315,000 pieces of PPE through our logistics department. And you know, it's just been one of those years, but we're not done yet. And obviously, you know, we still have the pandemic going, but our roles slightly changed. The infection is still out there, but we also have other priorities going on right now. And those priorities are recognizing that the vaccine is going to become more readily available, and how we can make sure that the county can facilitate the throughput of vaccines to all the to our citizens to meet, you know, what's coming in. And you know, right now things have been a lot crazy, and there's a lot of frustrations because there's not enough vaccine. But we have to look forward to the to where we need to be. And we've been working closely with Excella Health as far as helping them on their planning process and what we need to do, bringing in from the state and FEMA to make sure that they have that throughput going on as well. We're working real close with the intermediate unit as far as the teachers go. You know, I've handled a lot of disasters, especially when I was with PEMA. And the first thing that they tell us, your first step to recovery is getting your children back to their normal routine. So this intermediate unit teachers vaccine, the school staff vaccine is very, very important. You will never recognize how important this is in order for our families to recover, getting their children back to their normal routine. So we are strongly supporting that vaccination clinic that's starting this Saturday as well. So we got a lot of work still ahead of us, but I just want to thank everybody that's part of this committee and all the other entities that's been involved in that partnership that makes us a community. Thank you.
Thank you, Bud. I appreciate it. And as long as we're taking a moment to reflect, I just want to reflect at how grateful I am for the work of you and your staff. Bud, you guys have just done a fantastic job, and I've grown to really appreciate everything that you all do for the county. Thank you.
Thank you very much.
I'm going to move on to Dr. Matt Thomas, who's with us with the intermediate unit. I know it seems like we've been having that your work has been talked about quite a bit this morning, so I'm sure you'll have quite an update for us. Go ahead.
Thank you, Phil. Good morning, everyone. I am serving in the capacity of supporting this team. This morning, Dr. Conway is knee-deep in a lot of the organization. So if you all know Dr. Jason Conway, he's our executive director, and so I'm humbled and honored to be here. The Westmoreland Intermediate Unit's mission is to provide a collective support system that enhances educational opportunities for the community and the kids we serve. And when you look at our website, that is exactly the core of our mission, everything we do. So because of this core mission, we're focused on education, and to Mr. Mertz's point, we're trying to get kids back in classrooms. Many of our school districts have moved forward with in-person instruction at the guidance of the Department of Health and the Pennsylvania Department of Education. Right now, we're moving very quickly to support over 5,000 employees in education in Westmoreland County, and that ultimately leads to supporting over 46,000 kids, learners, in early childhood through school age settings. So as Mr. Mertz and others have already stated, the distribution of those 2,500 vaccines will start this Saturday at the Westmoreland Intermediate Unit. Our building is closed to anyone else, and so the registration process is very strict. We have social distancing, physical distancing guidelines in place for the building as these vaccinations will occur each day. It appears from what I've heard so far that the vaccinations will be at a rate of around 500 vaccinations per day. And this is supported by nursing staff and National Guard members on site at our administrative facility at 102 Equity Drive, right off of Donahoe Road in Greensburg. The process required pre-registration for any school employee, and it wasn't just teachers. We're thinking bus drivers, personal care assistants, classroom assistants, cafeteria workers, custodians, anyone. And it also was structured from the Commonwealth strategically through 29 intermediate units that are regionally positioned to support their area. We are a one county intermediate unit, so Westmoreland IU only supports Westmoreland County. But we do anticipate, based upon the registration and how the state has apportioned that it does, you are assigned to an intermediate unit. So just because you live in Westmoreland County does not necessarily mean you're assigned to our IU. That seems to be the trend across. For example, to our east, Altoona IU or the Appalachia IU8 supports a 4-county area, and therefore it's not necessarily just within that IU. But the key point there is physical and social distancing that will be managed by the National Guard and our staff and nursing staff on site. And it's important that we've been engaged to lead this work. This is awesome that we have regionally been coordinated with the Commonwealth, because that's our job. We're an educational services agency in the business of serving schools and families. So as this is the first wave of the vaccination process, do not fret if you are not able to make it into the first wave. The Commonwealth is currently organizing a second wave for educational staff or school employees. And again, we will be challenged with leading that effort at some point after this first wave is over. We're told that these lots are coming to us in around 2,500 vaccines at a time. And this requires the coordination of refrigeration on site that's been brought in and many other just logistical items on site for the staff that will be delivering it. The vaccine that's being used for education right now is the Johnson & Johnson. This is a single dose vaccine. And so this is not identical to the Pfizer or the Moderna vaccines that are out there. It's usually a 2-shot or 2-dose protocol. This also includes staff members and contracted employees for schools, such as bus drivers, cafeteria workers, and this also includes public schools, private schools, charter schools, any sort of school that's religiously based, our career and technology centers, and that, again, has been pushed through the entire survey process that Dr. Conway and others are leading at this point. We do service as an intermediate unit learners aged 3 through 21. The earliest learners in our program start an early intervention program, and that goes the whole way through to age 21 in our school districts, as well as our Clairview School at 215 Donahoe Road. If you look across the county school districts, classrooms and buildings have been transitioning back in person since mid-January. I know that our Clairview School on Donahoe Road went back around the 20th of January. Most recently, we were able to restore staff to the Regional Youth Services Center, Grande Boulevard in Greensburg, for the Westmoreland, right next to the Westmoreland Manor, where we service detention center students and the homeless youth shelter students. And through all of those efforts, many protective factors have been implemented to mitigate further spread of the virus. So to close, we're very happy to be a part of a supportive and thoughtful community across Westmoreland County. This is fabulous work. Think of us when you have a problem to solve, a need to be served, or coordinating any topic across multiple entities as we move forward. And as always, if you have a question, our website is www.wiu7.org. Direct mainline calls are taken at 724-836-2460. Thanks, everyone.
Thanks, Dr. Thomas. Really glad that you were able to be with us. Really important information. Glad we're getting those teachers safe. Let's move to Jennifer Miller now with the Westmoreland County Food Bank. Jennifer, how are things with food distribution?
Going well, Phil, thank you. We're still seeing a lot of people, but it seems like that this month, especially reaching the 1-year anniversary, I really would like to take the time that everybody else has to thank our partners, to thank our staff. It truly has been a challenge, to say the least, as all of you have been facing as well. But without our staff and without our partners and our wonderful board of directors, we truly would not have been able to accomplish the things that we have accomplished this year. We really, truly had to think outside the box, no pun intended, to get the people fed who needed it the most. And again, our partners out there, are majority of them are volunteers who risk their health to make sure that the health of others were taken care of. And we could not be more grateful and thankful that they are part of what we do. We just had found out that the summer food service program is going to continue on with its waivers. So in other words, that will be a grab and go type of distribution. We are looking for sites. So if there's anybody who is interested in becoming a summer food site, we encourage you to contact us and ask for Michelle Heller. She is the program coordinator for that project. You know, the summer food service program reached more people and more children, I should say, and served more meals than, as far as we can remember. We served over 20,000 meals last summer alone, and that was a huge jump compared to the year prior. Unfortunately, the way things are, you know, mitigates the fact that we have to be able to do the grab and go. And we're so happy that the Department of Education has decided to continue on with that waiver. We're hoping that that continues on into the future for no other reason as kids are different now. They don't want to be outside, unfortunately. They don't want to be socializing, unfortunately, but they still need to be fed. So we can encourage them to come out and socialize and be with, you know, with their neighbors, but sometimes that doesn't work, and unfortunately the kids lose for that. So you know, we would love to be able to continue to push for the grab and go option into the future. The SNAP outreach or the SNAP application assistance program we have here at the food bank is going gangbusters. More people now are signing up for food stamps or the SNAP program than ever. We did a mailing to people who have signed up for our services that indicated that they were not on food stamps and were not receiving those benefits. And just in February alone, we did over 100 applications just for SNAP benefits with a 70% approval rating. So that's saying a lot for the need that's continuing to be there. The Operation Fresh Express program is back. It's starting this month. We will be doing distributions quite differently than we have in the past. We will be, instead of having all of the product out on the tables, if you've ever witnessed a Fresh Express distribution, what will happen is all the product will be placed into the consumer's boxes. They will not be touching anything. All the produce and some of our dry goods that are being distributed will be pre-packaged either in boxes or bags. We will be practicing social distancing, and all consumers must have a mask on in order to receive the assistance. So we will have masks there for people who may have forgotten theirs or don't have one. We will have gloves for our volunteers, and we're very anxious to get this program back up and running and have that product be put into the hands that need it the most. The distributions are holding steady. We're not seeing a huge increase, but we're not seeing a decrease either. The senior food box program is the like. We're not seeing a huge increase, but we're not seeing a decrease as well. There's a lot of food service or food assistance programs still happening in our community. So sometimes that cuts back on how many people visit our pantries, but we're still going strong. We are back to sending the food out in caseload quantities to our food pantries, and they are pre-boxing or doing a hybrid type of distribution at each one of their facilities. And thankfully that went very well, knock on wood, I don't want to jinx it, but it went very well for February, and people were very responsive to that change. It was beginning to be very difficult to get volunteers to come into our warehouse on such a consistent basis to pre-pack those boxes. And if you've ever done a pre-packing event at our facility, you know it's very hard work to continue to do that day after day, week after week. It really, I think we burnt some volunteers out with due cause, but we truly appreciate them taking their time. I did want to touch base a little bit on the Farmers to Families program that's happening through the USDA. I know that many of you have probably read in the newspapers how many distributions in our local areas that have been canceled because the trucks have not been arriving. We were talking with the Pennsylvania Department of Agriculture yesterday, and with the understanding that the USDA is going to change this program. The problems that are happening here in Westmoreland County, unfortunately, are not coming through us. We opted out of the program after September when we saw the direction that it was taking, and they are sending that product out to a lot of smaller organizations who do not have the proper freezers and coolers to handle a lot of product. So unfortunately, you know, the program isn't working as well as they had originally planned it to be, but I wanted to let everybody know that they are looking at alternatives for that program going into the future and how it could possibly work better for the community. What is happening in Westmoreland County, from what I understand, is not an anomaly. It's happening all over Pennsylvania. In fact, one of our sister food banks in Philadelphia, who relied on the Farmers to Families program to provide, you know, fresh dairy, fresh meat, fresh produce to their consumers on a regular basis through their regular food pantry distribution programs, had about 4 trucks canceled, and that product was nowhere to be found. So we are a little concerned about it on our end, just for the sake of where is that food going? You know, how is the program being operated? But just to let everybody know, there is a solution in sight. That being said, that's all I really have at this point. Again, thank you to all of you for providing this avenue to share with all of our partners. And thank you to all of the organizations, either on the panel or listening. We truly could not do what we do without you. Thank you.
Thanks, Jennifer. It's been quite a year. Glad you're on top of it. Let's go ahead and move on to Deb Thakura with Feeding the Spirit. Deb, you're with us?
Yes, I am. Thank you, everybody, for allowing us to have this time. And to echo Jennifer and everybody else that has commented already today, we could not do what we do without all the partners. And we are so grateful that throughout this past year, even though we've had to pivot and we've had more challenges, we have had so many new partnerships and so many continued partnerships in so many ways, from the other agencies, from the community, from the religious community, and even from our individual donors. We have seen people in the past couple months call us and say, wow, we want to make sure you can continue your mission. And we know that this pandemic has put a crimp in a lot of nonprofits' resources. So we want to give extra, or what can we do to help? And again, that is just says volumes for our community in Westmoreland County, that people do care and people do see the need. And as we go into getting the vaccines and more people are feeling safe and secure, our community still knows that there are challenges out there, and that gives us so much hope. This last February, we have been consistent with our food distribution. The numbers have not gone down, but that's good news. We are holding steady. We distributed 846 hot meals in February at our meal distribution, and we continue to do that every Thursday at 5 o'clock. We also have seen more sponsors step up and say, we understand how you're doing this now, and we still want to sponsor a meal, even though you don't have a sit-down meal. So let us help. And it's been wonderful. I think we're booked up with weekly sponsors through May now. And again, that just shows the heart of the community understands, even though we do things differently, they still want to help. We're very humbled, and we're very grateful to everybody for that. We touch on rent assistance, obviously, and hotel stays, because the housing crisis is still not going away. And what we did see, though, in the last month, the number of homeless placements, emergency placements, have gone down for us, which we're very happy to see. We placed 40 individuals instead of 60, so it was cut in half just this last month. We hope that that means the stability of the transitional housing and working together with the other housing programs is providing a more secure safety net for those in need of housing. And we look forward to partnering with the Housing Authority, Union Mission, Welcome Home, and everybody to continue to have that security. That's about all I have, and thank you, everybody, for all that you do. We're thrilled to be part of this all.
Glad you're still with us, Deb. Thank you so much. Appreciate it. And let's hear a little bit about housing. Dan Carney, are you with us?
I'm here. Thank you for the opportunity to share. Probably the most pressing and important thing, some folks might have saw it was noted in the paper that the Emergency Rental Assistance Program, ERAP for short, will be kicking off. We're hoping to launch that in early April to start accepting applications. That program is designed to help households with utility and rent assistance for households under 80% AMI. And if they have, if they're on unemployment or qualified for unemployment or have experienced a reduction in income or have significant costs or financial hardship due directly or indirectly to COVID, and can demonstrate that they're behind in their utilities or rent, and that could cause some homelessness or housing instability for them, we will be able to provide assistance through that program for them. There's a priority for under 50% AMI and for those that have been unemployed for the 90 days leading into their application period. So we will be prioritizing those populations, as the Treasury has indicated those are the priority populations. Right now, if folks visit our website, theunionmission.org, there's a pop-up to sign up. So we have landlords and tenants who are signing up for release of information once the application period starts. It will be a completely digital process this go around for the applications. We know that a lot of folks will be able to do it over their phone. It'll have multiple languages readily available out of the gate for them. And we're planning to and are building some mobile staff who will be able to go out for folks that don't have technology and need hand-over-hand assistance. And we're connecting with sites in key areas throughout the county to also make sure that technology is available if that's the barrier. So folks can still access the technology and complete the application themselves and or request assistance that we'll meet with them either at a site scattered throughout the county or go directly to their home and help them do the application. So look for that to launch in April. That can help with up to 12 months of rent and utilities for folks. And so we do anticipate, we've got about, I think, 500 people already signed up on that email distribution list. So it will, I'm sure, kick off in a feverish storm. But right now, that's probably the big priority is that stabilization. As we hear everybody else talking about how do we start to move away from, get back to normal or as normal can be. We know that helping our households recover financially from the hole that they're in and helping our landlords, especially who are really struggling with maintaining their houses, maintaining property taxes, things of that nature, and get them back on track will be a huge impact in the community. As Deb said, those collaborative agencies that are delivering housing and homeless services are continuing to operate. There are still additional programs and layers of funding attached to make sure we can serve folks in need in community. So if you have anybody that's experiencing a crisis, if you can connect them to one of those agencies, we're all collaborating behind the scenes and trying to make sure that we connect folks to the most appropriate resource for them and the one that's going to help them out to really stabilize their housing. And that's it in a nutshell. Again, just if folks are interested, we'll be sending out information and flyers as well, but if they want to get signed up to be personally notified or you want to sign up to be personally notified, you can do that on our website.
Great, thank you so much, Dan. I just and as a side note, it's my experience that many of the folks that are really experiencing hardship right now have never been in this scenario before, and so they're not used to asking for help. They don't know where to go. They often think, well, that's not for me, that's for other people that always need help. And so I just want to encourage folks to make sure that they reach out to Union Mission. I just went on the website. The thing pops up, super easy to do. So encourage folks to ask for help now so that they're not trying to play catch up or really scramble when they're facing homelessness. Is that fair, Dan?
Absolutely.
We're gonna hope so.
Yeah, that is fair.
Good.
Yep.
Great. Let's round this out by moving on to our last speaker, Jordan, with the Hill Groups here to talk about our human services study. Jordan.
Good morning, everybody. Thank you for having me as always, and I'll try to keep this brief. The human services study is in its final phase here. We have a draft final report. I think I reported last month, actually, that we've been socializing that report with a number of you actually on this call have seen or heard parts of those findings and recommendations. They are not drastically different than I've reported to this group over the last 5 or 6 months. And really kind of taking Bud's lead in what he said earlier about how the last year has forged partnerships across the county. This call being one example of that is really the starting point. We think that there are tremendous strengths and assets within the human services ecosystem in Westmoreland County, without a doubt. And the last year has pushed many players within that ecosystem, organizations and individuals across sectors, to work together to improve the 3 C's, which are not what we've characterized in our report. Cooperation, communication, and collaboration, but it makes a whole lot of sense. And what we are suggesting, and what our steering committee is suggesting, is that that groundwork that has been laid for many years, frankly, but really over the last year, is a fantastic jumping off point for creating even greater systems for human service assessment and delivery throughout Westmoreland County. And so I've mentioned these 3 categories before, but what we are ultimately recommending for Westmoreland County as a whole is that there really are 3 major buckets, if you will, of recommendations. Number one is around the sort of county level structure itself, creating a more streamlined and integrated human services system. Number two are recommendations to increase the capacity of individual providers throughout the county. You all know that so much of human services delivery in Westmoreland County falls on the shoulders of nonprofit organizations that are delivering these services, right? You might also know that that's not the case in every county, right? It's a continuum of sort of relying on a few organizations to relying on many organizations. And in Westmoreland, we rely, on many. And so anything that we can do to increase provider capacity, make sure that those providers have the resources and the capabilities they need to deliver those services efficiently and effectively will go a long way. And then finally, around expanded access to services. So we know that even if we build the world's greatest human services ecosystem in Westmoreland County with high capacity providers within a nicely integrated system, there still will be barriers to access because of Westmoreland County's geography, topography, size, rural nature in many parts, right? Things are just hard to get to and hard to access, and you all know that acutely well. So recommendations to enhance that access are also included in this report. So over the next few weeks, I think these findings and recommendations will become more public than they are now, and I look forward to that. So as always, if there are any questions, comments about these recommendations, we are here to help.
Great. Thank you very much, Jordan. And thanks to all of our speakers. I know I was looking at the questions box. There are a number of questions that came in. So we will be taking those questions, sending it to our panelists, to those that we think are probably the strongest to answer those. And then we will email out the answer to those questions to those individuals that had some questions or concerns. So that's our normal practice, and we'll continue to do that. Thanks again. I don't have anything else from the Community Foundation side. Alyssa from the United Way, anything that's popped into your mind that you want to share before we go?
Nothing except how grateful I am for everything that's going on. I think just amazing stepping up in so many ways for people who have already been stepping up their whole careers in this space. And so thank you so much. Just great to see all these partnerships, collaborations, and good work that's being done here to help our folks in Westmoreland County and beyond. So thanks.
Thanks, Alyssa. I absolutely agree. I appreciate the hopeful tone of this meeting today. So only good things ahead of us. Well, thank you so much, everyone. As you can see, we've got 3 additional calls coming up. We thought that we would go ahead and schedule meetings through the second quarter. And then maybe at that point, it makes sense to let off of our meetings, but we'll sort of decide then and take it as it comes. But since we still are in the midst of vaccinations and making sure that everyone is taken care of, we thought it seemed appropriate to continue to meet once a month through the second quarter of 2021. So you can see those dates there. Again, it's always the second Thursday of the month at 8 a.m. Thank you so much, everyone. And we will see you next time. Keep up the good work.
Thank you. Bye.